Dr. Singh, what are the benefits of having everything done in one location?
Everybody asks what's the benefit of having everything done under one roof. Well, having it done under one roof is convenient, but it's not the most important part. The under one roof concept basically has more to do with planning the final restoration, understanding what we want to end up with, then designing the implant placement and the solution to be ideal for that, to be able to support that solution. Going back to your analogy again, it's designing the house and agreeing on the blueprints and all the requirements that we'll need in the house before we decide where to put the foundation and deciding how much of a foundation we need or do not need. So it's basically planning that's generated to the final solution. The old-fashioned way of doing it, for example, would be a dentist would refer you, let's say, to a radiologist. The radiologist would take an X-ray and have a look at the bone that's available. Then that would be sent off to a surgeon. The surgeon would go ahead and say, okay, I got some bone here, I'll put that implant in the middle of the bone. And then send it back to the restoring dentist who would be able to say, okay, now I got the foundation, let's see what I can build on it. So it's basically driven by the position that the surgeon placed the implants, and he placed the implant without understanding what the final solution would be. So that communication process is what makes it often. Sometimes it works out because you have pretty much it's pretty obvious where that implant should be, but in some cases it's not because the final solution hasn't been decided on as yet. So I believe in the concept of understanding fully what the final solution is and designing the foundation to serve that solution as best we can.
Dr. Singh, can you help me understand the concept of everything under one roof?
The concept of doing everything under one roof is that we're executing from the same blueprint. We're working towards the final goal and doing that in the most efficient manner possible. So convenience, efficiency, and there's no chance of miscommunication because we don't have to communicate with anyone else. We're doing it ourselves. And of course, that all translates into a more efficient process, which for the patient means a more cost-effective process as well.